right. Good afternoon. And yes, both of us are here today. And so we're going to do a little change in order. I'm going to go through the numbers. And I'm going to hear Dr. Yaffe will talk about a topic that's very much in everybody's mind, going back to school and how to prepare for that. Because I already talked to you about that last week. So I'll let you hear it from Dr. Yaffe to see what her comments are on that today. So today's Monday. So we talk about what happened over the weekend. And we look at our numbers. And as people were a little concerned early on Friday and Saturday, we went from 122 to 148. But then Sunday and Monday, back down to 112 and 114 as of today. And that's in the presence of a lot of lab testing being done, which I'll talk about in a moment. So we're down to around this low hundreds. Watching our numbers here, our positivity rates coasting around 0.6, 0.7 in that number there. So it's not that we're not doing a lot of testing. We are. As of today, we did another 25,098 tests over the weekend. We were over 30,000 on some days there. And so it's indicative of what we're doing around the province. When we looked at our numbers, where they're focused in our larger urban centers, mostly Toronto, Peel, and Ottawa. And in their discussions, they're finding numbers that are related to outbreaks in institutions, as well as people in different gatherings and groups still disregarding the public health recommendations and being less than vigilant in their adhering to the public health measures. But still, 30 of our 34 health units reporting fewer than 5 cases, 18 with no cases. So it still is in effect there at this time. And we continue to keep pushing on the different public health measures to ensure that we keep our numbers down and even likely or hopefully even drop them further. And this is so concerning because we've seen in some other parts of the country where they've been much lower than us, and now they're having some resurgence, some issues there that are the same counterpoints as we're saying that we need to continue to do our points. What? Masking when you're out in public and you can't maintain your 2 meter or 6 foot distancing. Stay home if you're sick. If you feel you have some aspect where you've been exposed to or potentially exposed to or feeling unwell with signs or symptoms of COVID, do go get tested. Wash your hands regularly. Use hand sanitizer when you can. So all those messages are the same as in stage 1. We've added masking in stage 2. And stage 3, we're continuing that process because we're now into 4, going to 5 weeks at stage 3. And there was concerns early on that it was taking off. We've seen that come back down, so that is encouraging, and everybody needs to keep doing what they have been doing and do it again and do it even better in the future. And that's really appropriate because as now we're going to add into going back to school, both post-secondary, but also the main thing, a feature, an issue, is going back to elementary school, going to high school, and we have our child care centers picking up even more. And so we're watching all those with our plans and processes in place that we've talked about before. And we're putting all our things in with our hiring of our public health, our nurses and our public health units to undertake a more increased surveillance approach, our testing ramping up, and so all things we're doing as a government in that arrange there. But so those are the main things there, but there's other things that you need to do on a personal basis. And I'm going to ask Dr. Yaffe to talk about preparing for going back to school and her comments on that. So over to you, Dr. Yaffe.
Okay, thanks very much, and good afternoon, everyone. With the first day of school approaching, we know that many parents and children are feeling anxious. And for those children returning to the classroom, it will look very different than it has in the past. Modeling healthy behaviors at home and talking to your children about what changes to expect will help ease the transition back to school. There are many things that families can do now to help prepare your child for in-person classes. First of all, review and practice proper hand-washing behaviors and techniques, especially before and after eating, after sneezing, coughing, or adjusting a mask. For younger children, singing a song that lasts about at least 20 seconds can help them remember how long they need to wash their hands. Secondly, review and practice how to properly wear a mask. Have your children practice wearing their mask for longer periods of time before they head back to school, and remind them not to share or swap their mask with their friends. Thirdly, review with your child the basic health measures that will be in place for this school year. Things like covering your cough or sneeze properly, keeping a distance between themselves and others, not to share food or personal items like pencils or erasers, and telling staff if they're feeling sick at school. Next, talk to your children about the fact that their lunch and recess routines may change to allow for physical distancing, and they may not be able to see their friends in the way they used to. While it's important to talk with your children about COVID-19 and discuss their concerns and any questions they may have, you can also help them prepare for school by focusing on the things that they can do to help keep themselves healthy. As well, it will be important to tell them that every morning you as a parent will be asking them how they feel and making sure that they are feeling well so that they can go to school healthy. While there will be changes, they will still get to learn new things in a class with their teacher, and they will make new friends. We know this is a challenging time, and we know that feeling anxious and nervous is to be expected, but every one of us needs to do our part to support a safer return to school. Thank you.
Go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
First question will be from Randy Rath at CHCH-TV.
Hi, doctors. I'm wondering about the casinos in the province. They currently say there's no way they can afford to open with only 50 people allowed in a room. And some of the casinos, like Niagara Casino, for example, has spent over $1 million installing safety gear, plexiglass barriers. They've even hired an epidemiologist. What do you need to see to allow casinos to open with more than 50 people in them?
Well, our public health measures table, in consultation with the cabinet committee, have put in the stipulations around the internal gatherings of 50 at this time. We have moved to make it that if you have multiple rooms, you can do that in some aspect to maintain the distancing that's proper in that context. So we have done that with hotels and convention centers, as well as with some of the facilities such as like movie theaters, and also with casinos. So we would like them to look at and to operate as best they can at that time. It may not be exactly as it was before, and that's part of what we're talking about, the new normal at this stage. So we're still in stage 3. There are concerns already raised by some that we might be moving too fast. As we heard on the weekend, some were already rumoring that the data and what they're seeing in other parts of the country indicates that maybe we are opening too quickly. We think it's a reasonable amount at this stage. Our numbers have come back down the last 2 days, so it may give us further indication that people are being contained, consistent, and managing it properly. So we would ask that the various casinos, including large ones like the ones in Niagara Falls, that they would try to follow the process at this time, and we would see how the data shows over the next number of days and weeks to see if we're staying down that number and can we adjust that or not beyond the stage 3 level in there. So we applaud various institutions and places that have put in various infrastructure and materials that would satisfy that. We will continue to have that, especially casinos, will be addressed through the Minister of Finance, and to get recommendations accordingly how we might want to look at some further things in the future. But right now we're just trying to make sure that stage 3 is handled in a consistent way, a safe way that satisfies all sectors, including the public of Ontario, that things are being done in a safe, consistent way, and the community spread is not wide and happening because, as Dr. Yaffe's alluded to, one of the things we're trying to do is to get our schools, our post-secondary institutions open, and that really depends on the community spread or the community presence at that time. So we want those numbers staying down to ensure a safe school opening. It may seem a wide stretch to go from a casino to a school. We hope they don't have that much in common, but the fact is that they are part and people go to and from community, and we want to keep those community numbers down, especially in the next few weeks as we start into school opening, and we want to make sure it's as safe as possible for all sectors. So it may be perplexing to them, but we'll ask them to be patient and wait, and we'll get to that when we feel it's safe to do so.
Follow-up?
Yeah, on a different subject, I was in the store the other day. The Halloween stuff is all out. Are we going to have to cancel Halloween this year? Is there any way that kids can safely go door to door trick or treating?
Groups and some of our medical officers have asked that question. So our public health measures table is looking at that. I've heard even other larger gatherings in the future, even related to the festive or Christmas season, other things we have to consider. So this is a new area for us to look at, and we're trying to ascertain what can be done, could be done. Can it be offered in a safe way or not in that context? So I don't have a firm recommendation at this time, but it is before our committee as they're looking at some aspects in that and this and beyond that. So these are new things to look at in our new normal. And if there's ways it could be done that's safe, we'll see what the committee says and further recommendations coming forward. So it is there, and we're not even the end of August, and we're already thinking of the end of October. So it gives us some lead time, but we want to make sure we're up on that and see if we can clearly give some recommendations to our public health units, and to the retail sector accordingly.
Next question.
From Cynthia Monaghan at City News, please go ahead.
Hello there, doctors. I'm just wondering, one of the main things that families and teachers are feeling anxious about are class sizes, and there are no caps. I was talking to the TDSB via email, and they tell me that they don't have a sense yet of what the class average is going to be. Certainly they're putting more resources into schools that are deemed to be higher risk. But if we do see classes, some of them maybe 30, and kids in tight quarters, what action will you take, or will you take an action? Will you allow a classroom, a crowded classroom that doesn't have physical distancing, to continue?
Dr. Yaffe?
I'll start. I think Dr. Williams may want to add. I think that from a public health point of view, we've been very clear and continue to be clear that physical distancing is an important measure, but it is not the only measure. There are multiple layers of measures. Everybody will be wearing a mask. Everybody will hopefully not come to school if they're not feeling well. That is very important. The parents will be screening their child. The staff themselves will be screening and making sure that if they feel ill, they don't come to work. We're looking at access to hand washing facilities, good disinfection and cleaning, signage. So there's multiple measures in place, and cohorting. So there is no specific number that I would say above X number, that's no good. The issue is trying to maximize the space, perhaps have physical barriers like plexiglass to help, and to monitor how it goes. So I think cohorting is one of the key parts as well, making sure that kids are with the same people as much as possible, so that if there is a spread of infection, it's limited to that group, and the public health unit would be facilitating their contact follow-up as well, so that we know that the spread has not gone beyond that group.
Follow-up?
Okay. Yes, thank you. But again, back to my question, if there are classes in schools across the province that are crowded, because I know classes vary size by size, if there are classes that are crowded, even with the other measures, will that still be allowed to carry on?
So I think in there you're asking the, like often my grandchildren, they ask questions like the if game, if whatever. Part of that, we're trying to see what will happen. How will they be set up? They are doing that now. And our public health staff that will be going around looking at different schools, there will be unique situations. Someone said they might have a large senior grade with 30 in the gymnasium. And having written exams in gymnasium, we were 6 feet apart because there's no cheating allowed. So that can be done. So I think there's situations in each school. There are different layouts, different physical plans. I think we have to wait to see what the class enrollment is, to see how they're going to set that up. I understand from the Ministry of Education they're doing all they can to endeavor, as Dr. Yaffe alluded to have the spacing, masking, all the different levels in there. And so we'll have to assess each situation as it arises and see if there's areas of concern, whether it's corridor crowding, when that can be splayed out differently, washroom usage, how do you make sure that can be done? So there's lots of things to look at as far as doing infection prevention control. In a school setting, where we had to do that all the way through with our long-term care facilities, our retirement homes, and also it's always been an issue as looking at with hospitals too. So that's what we talked about by bringing infection prevention control. It's one of the general framework, and then consulting and having some assessment of a situation and reviewing that with public health and with ministry people to make sure, is this the best solution? Is there a better way to do it? So we'll take it on a case-by-case basis if and when it does occur.
Next question.
Is from Laura Stone at the Globe and Mail. Please go ahead.
Hi, doctors. I wanted to ask you specifically about the Ontario Education Unions filing their challenge with the Labour Board today. Did you consult with any of these unions when you were when the government was coming up with the plan? Did either of you reach out to them? And if not, why not?
So, as you mentioned, there is a filing in the court, and as usual, when there is a court undertaking, we're not really at liberty to discuss a lot of the matters on that, and we'll have to seek the advice and direction of our legal counsel if and when, and of course from the lead agency, which is the Ministry of Education, to comment on that if and when the time is appropriate. So we really can't say too much on this at this time.
Follow up.
Okay, but the unions are saying, Dr. Williams, that even though you've endorsed this plan, that they don't have faith in your endorsement. Essentially, they say that it's at best mixed based on what other medical experts are saying. So how is the public supposed to have confidence in this back-to-school plan when the unions are so dead set against it?
So when I was asked about last week, what basis do we give our recommendations on, have I sought the advice of any medical experts? And I noted that we have a number of committees at the resource that are making recommendations to my office. We have our Public Health Ontario, we have our scientific table, we have many tables at Public Health Ontario, we have our medical officers from across the province, we have our federal, provincial, territorial committees that each have their own meetings and committees and staff. They're reviewing all the ideas around what is safe school, what are the things you have to put in place, what are the hazards of not going back to school, what are the risks involved there. We have our international groups looking at and sharing the data in the international jurisdictional scans. So there are lots of recommendations coming in from medical experts that's saying, here's what you need to have in place to have it safe, as Dr. Yaffe has alluded to, all the different processes. So we've been taking that advice from our medical experts because our approach is a public health measure to ensure the safety and health of both the students and the teachers and the custodial staff as best as possible. And we want to make sure that's as best with the most evidence and scientific recommendations we've had. So we will continue to depend on the input from our scientists and our medical experts, including child health care experts as well, to make those recommendations in consultation, of course, with the Ministry of Education.
Next question.
Is from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob. You on?
Please go ahead, Rob.
Can you hear me? Sorry.
Yeah, we can, Rob. Thank you.
Okay, sorry. I got another call coming in and I can't find my mute. Anyway, today the Premier said he wouldn't hesitate to shut down schools if he had to. And given that the trajectory of COVID has changed a bit, what kind of situation would it have to be for you to shut down schools again?
Okay, school or a school. If you're asking schools writ large, as we did in March, or you're talking about a school that is a concern to us and closing that school. Which were you asking, Rob, or both?
I was more asking about a blanket decision to close all schools, but it would be good to know what might be a trigger in it to close an individual school.
Okay, well, let me ask Dr. Yaffe to answer the question about an individual school first, and then I'll answer the one about the school system writ large, if that's what you're referring to. So over to Dr. Yaffe.
Okay, thank you. So obviously we're talking about if anybody feels ill, the first step is they need to not be in the school, they need to be home. And if in consultation with their primary care provider, they may be recommended to go for testing for COVID-19 at an assessment center. And if we have one case confirmed that is reportable to the local public health unit, they would, very quickly take this as a high priority and organize that all the other students in that cohort and the teacher be sent home and isolated, and if they develop symptoms, get tested. So if we end up with more than one case confirmed where it appears that there's transmission in the school, that is when we would be considering possibly either closing just certain classes or the whole school. It depends on where the cases are and how much they've mixed with others, and are they all in the same grade, are they in different grades, and so on and so forth. So I would say that I know in our experience in the past, for example, with H1N1 flu, with SARS, the schools have tended in the past to want to close when it may not even be necessary. So it would be a discussion between the public health unit, the school administration, and at the first, certainly few would be involving us and the Ministry of Education. It's not a decision that's taken lightly, but if it's necessary for health and safety, it would be done.
And to answer your other question, the reason for closing, like what we did back in March, the whole school system, back then, as you recall, what happened is that we had a large influx of cases, and our numbers went from under 100 to well over 500 to 600. We're already up to 3. It was rapidly rising up to 300 to 400. So we knew we had community-wide spread, and the influx of people infected was throughout the whole province. So we couldn't be, couldn't be assured that there wasn't spread wide through the communities. And of course, the school reflects that. And the children are, of course, good vectors of infection. And so the way to help to interrupt that was to close the schools so that wasn't adding to the complexity at that time. If we return to that, and I really don't want to anticipate that because we're trying to keep our borders closed, we're trying to look at screening very carefully, we're doing all our case contact management so we don't repeat that episode again. So it all depends on if we end up with all of a sudden again widespread community infections, numbers well over 500 to 600 or 700, and we can't be assured of any containment throughout the province, then we would, as we had before, start to do some steps to close down things where there's potential of even more community spread, as in some parts of the society, in schools and other ones accordingly, if we did face that, especially in a very bad second wave. Right now, I'm looking at the optimistic side of not seeing that. If our case contact management continues, and if we're very careful with our borders and screening and quarantining people as they come in, so we would want to contain it on a local level, on a regional level, and also on a provincial level. So the context would be similar to what we had experienced back in March, Rob.
Follow up?
Okay, thanks for that, and I found my mute button. Just a slightly different question. I noticed that over the weekend, the number of active cases went from 1,100 to about 1,220. That's like a 10 or 11% jump over the weekend. Does that concern you?
The number, yes. On the weekend, as you remember, on Friday and Saturday, we went from our low 100s and under 100 to 122 and then up to 148. And we had seen other provinces, some hadn't been to some of their highest numbers they'd experienced, who had been basically very low. In fact, some had experienced, some provinces, no cases on some days. So that was concerning to say, is this a trend and a direction? So we were relieved to see that even with large numbers of testing, our numbers dropped back down to 112 and 114. We did ask about some of those numbers around that peak, and we found in different health units clusters of outbreaks around some workplaces, some places where people had gathered in social gatherings against the advice of public health officials in undertaking risky behavior, which was disconcerting in there. And of course, they tested groups in those areas, and there was transmission within those community, or I shouldn't say, family social gatherings. So again, emphasize the need for people, as I said before, to stick to the task. And even though we don't have large numbers here in Ontario, back down to hundreds again, there's still 100, 110, 112 cases every day, and there are various areas. So you may not have it in your area. It doesn't mean that someone may inadvertently you get exposed to if you don't maintain your distance, if you don't wear your mask, if you don't do the proper steps. So we still have to be firm on that as we go forward because we want those numbers down even lower. So it was concerning, made people worry about stage 3. Was it too quick, too soon? Let's hope we can stay down and drop down a bit more, and that we can show the evidence that Ontarians, as they have before, are sticking to the task, doing what they need to do to keep this down, and I'd like to think even avoid a second wave. But that's why I think the Ontarians are up to the task, and I think we can do that.
Next question, and this will be the last question.
Is from Heather Wright at The Independent. Please go ahead.
Good afternoon. The province has just announced residents of long-term care and congregate care settings can leave their home for short-term visits. The minister says this is going to help mental health, but a lot of people can't get out. So why wouldn't we open those homes to visitors?
I can speak to that. I think that I know that the Ministry of Long-Term Care has been working on modifying their visitor policy, and we're working with them on that, and it's expected to be released quite soon. So the visitor policy will be somewhat looser, and you're right, some people cannot get out. For those who can get out, the change in short-term absences is helpful, but it's not enough. We do need the visitor policy to get loosened up as well.
Follow up, and this will be the last question.
So will that policy then allow families to be inside those residence rooms?
I think the details are still being worked out, but my understanding is yes.
Okay, thanks everyone.